My name is Moriah Engelberg. I work for A Better Balance as an organizer to strengthen paid medical leave in New York. A Better Balance is a national nonprofit organization that advances justice for workers caring for themselves and their loved ones. Right now, we are working on a coalition to strengthen paid medical leave in New York. I will give you a little bit of a background about what the paid medical leave system that we have in New York currently is. So right now, New Yorkers have paid family leave, which allows New Yorkers to take paid protected time off to care for a loved one or to bond with a new child. This paid protected time off is given to workers at like 67% of their paycheck. They have 12 weeks and their job is protected, meaning that once that time is up, they're able to go back to work when they're ready. However, if you yourself are sick, your benefits are capped at $170 a week. You're not guaranteed job protection, and you don't have the right to maintain your health insurance while dealing with a medical crisis. This system is pretty outdated. This $170 number has not moved since 1989. In New York in 1989, $170 a week was a workable number. I don't think I have to tell anybody that $170 a week now is not workable, especially if your job is not guaranteed once you recover from a serious illness or injury. So yeah, that is what we're doing, is working on a bill in New York to make sure that New Yorkers who are seriously ill or injured are entitled to paid protected leave so that they can maintain their health insurance. Their job is there for them when they get back. And to also provide people, the last thing you need to be worried about if you're going through a major illness or a major injury is like, is my job going to be there for me? And can I make my rent? It is a high time that we have a better paid medical leave system in New York. So I think, this is an important issue for all New Yorkers. And if you look at it in the way of, for example, endometriosis, it's like, if you yourself have to take time off of work to get surgery and get treatment, the person who's taking care of you has better benefits and better job protection than you do. And that's just backwards. So very much time to change the law.
Yeah. And what ushered in this focus on changing the law? Because like you said, this has been going on since 1989, and now here we are. How did it come to focus?
So in 2016, A Better Balance helped to pass paid family leave in New York. And there was this issue has kind of been this issue, as you said, has been going on since 1989, but it wasn't really feasible to work in both at the same time. So basically since 2016, this has been an issue, and it has been, a large issue since then, and it continues to be. But I think part of the other issue is that a lot of people don't necessarily know that this is a benefit that people can access if they need to take medical leave. And it's high time.
How can people rally around this? How can a New Yorker say, okay, I want to help? Is there a petition to sign? Is there anything they can do to get involved? I know there's the coalition.
Yeah, so I think absolutely anybody is welcome to reach out to me if they have something, a story that they want to share, something they want to talk about. They want to make sure that like this, they care passionately about this issue. They're absolutely more than welcome to reach out to me. I think in the future, we're going to have a little bit more concrete next steps for people to help rally around this issue, because it is such an important one. And I think this is an issue that touches so many of us that I can imagine there are a lot of people who are ready to start rallying.
Do you have to be a New Yorker to show your support for this? Is there any ways that people that might live out of state, but they have friends in New York, they have loved ones in New York, and they want to show their support for this?
I think anybody and everybody should definitely show their support for this issue, and making sure that we have paid medical leave has been an issue that's going around across the country. There are now 13 states that do have a law on the books to make sure that we have paid paid medical leave. And so you don't have to live in New York. But this particular bill that we're working on is only going to impact, this one is focused on New York right now. Doesn't mean we won't focus on others in the future, but this is the one that we're working on right now.
Also set a ripple effect for other states. When you do it for one state, other states might follow suit. So it's a good foundation if this one gets passed into law. In terms of guarding the job, so we're talking about paid medical leave, but is there language in this bill, and maybe it's a little too premature, but is there language that prevents a supervisor, an employer from, let's say, letting someone go after X amount of time went on? So they took paid medical leave. Let's say they were out of the job for a month and they came back and they had their job for 2 more months. And then the corporation pulled kind of a dirty trick and said, okay, well, you know what? You're just not performing at the level you were performing at, and they're an at-will employee. I mean, is there, with anything, there's clearly holes that any clever corporation can try to find.
Yeah. And I am like certain that is something that will happen. And for that answer, I will definitely plug our helpline, which is a free and confidential legal helpline that if you find yourself in that position, to definitely contact our legal team. I myself am not a lawyer, so I can't necessarily answer those like in the weeds legal questions, but our legal staff definitely can. And I will just say that phone number is 1-833-633-3222. And that folks should definitely reach out if they do find themselves in that position, because I imagine like there are, people are going to want to just kind of like skirt around these kinds of protections, and they shouldn't. So I will definitely plug our legal helpline for that.
Yeah, that's great that you have one and that you've already put that as backup, because unfortunately we do live in a society where people are seen as disposable. And if there is an issue and you don't have anyone really who has your back in a corporate setting or a work setting, it can be really scary to take that time off, especially when you need that time, when your health is utmost important, as we know in this life, but it doesn't always work that way with capitalism. So to have this law is just another way to guard people from being unnecessarily and unfairly terminated. So thank you for your work. We'll be sure to, get that website out there, how anyone can support this bill. So thank you for your advocacy.
Thank you so much. Thank you for the time. I really appreciate it. And yeah, if you have any, I'm happy to like put in my email address if people want to reach out to me. I'd love to create like continue to create a really strong and robust coalition, because I've really strongly believe that this is something that impacts everybody. And even if you don't necessarily think it might impact you in the future, it is essential that we have this protection for folks who need it.
Yes, nobody can predict the future. And when you're working as hard as the American worker is working, you want to be sure that when life sometimes throws you those punches, that you've got something in place that will help protect your rights.
Yes. And, this bill covers folks who maybe need to take time off for mental health reasons, medical reasons, surgeries, accidents, and it is like a really broad encompassing bill. So yeah, I just thank you so much for your time.
Thank you, Moriah.